Hello, good afternoon, everyone. Thank you once again for joining us in this episode of Doctors Go Live on Columbia Asia Facebook. Okay, today we have with us the consultant cardiologist from Columbia Asia Hospital Setapak, Dr. Min Yeong, about heart diseases and sudden deaths. Hi, doctor. Thank you so much for making time to do this. We really appreciate it. Okay, doctor, we all have heard of people suddenly collapsing and just passing away like that without any warning. So there are certain telltale signs that we might have missed. So we'd like to talk to you about this. Hopefully, it will help prevent something like this to happen. Before we start, maybe you can share with us statistics regarding causes of deaths in Malaysia.
Sure. I prepared some slide for the talk. Okay, this is, as everyone can see, this slide actually summarizes the 5 principal causes of death in Malaysia. So number 1 to number 5, and number 1 is ischemic heart disease, which is also known as heart attack. And if you break down into the detail of how they die, actually sudden cardiac death is one of the major cause of it. We will elaborate further later.
Okay. Doctor, because we hear of a lot of these cases due to heart attacks, cardiac arrest. I know that later we're going to go one by one and see what these mean. But it's different, right? Heart attack, cardiac arrest, what else is there? There are so many terms, of course. But these are all different from one another. And we cannot put them all in the same group, correct?
They are well, in Malaysia we like the broad term, the umbrella term. So everyone who die because of heart, they will say it's a heart attack. But they are slightly different in between each of them. Okay.
All right.
From this slide, we also see that at least 50% in Malaysia die every day because of this heart disease, this heart attack, sudden cardiac death. And who are they? They are majority 41 years old and above, which is the main contributor to our social economy in Malaysia. So this issue is very important.
Okay, since we're on that note, maybe we can take a look at some of the examples of people who have died suddenly without warning. I know some of them are have been famous people also. I understand you have a slide that you can share with us.
Sure. So after I got this topic for the talk, I go Google online and Google around, see what's going on. It's not uncommon to find out that those news that a previously healthy person, a very well disciplined person who collapsed and died, and in between there are across different age group, different professional, and there are some of my idol like Stanley Kubrick, which is all-time well-known directors, or famous basketball players, very talented young football players, and as well as a well-known illustrator, Andy Warhol, as well, dies because of heart attacks.
I think even in Malaysia also we have come across some well-known corporate figures and also celebrities who have suddenly passed on without any signs, which have shocked their friends and families. So this is what we're going to address. What kind of condition that will just suddenly shut down somebody's life without any warning? Okay, doctor, since we are at this stage of the session now, let's talk about the most common causes of sudden deaths.
Okay. I still remember when I worked in an emergency room, if a person brought in for sudden death, these are the 5 main diagnoses that come into our mind. Number 1, of course, is sudden cardiac death. We'll elaborate more later. Acute myocardial infarction. This is actually the real term for heart attack. It's more well known by our fellow physicians. Intracranial emergency means any any sudden disease to our brain, like bleeding or severe stroke. Pulmonary embolism simply means that blood clot in our blood vessel inside the lung that prevent lung working properly. And
Right.
also, I think catastrophe also recently got a few incidents whereby
Okay.
I think the biggest blood vessel in our body is
Mm-hmm.
uh, abnormally dilated up
Yeah.
and burst after that. So it's a very critical emergency.
Okay. Of these five, which are the ones that has to do with cardiology? Of course, sudden cardiac death, and then number two. See, because I can't pronounce it, I just did the points. So number one, number two, and number five. Three and four
Yeah.
has nothing. They have nothing to do with cardiology.
Well, not directly, but the causes of it are interrelated. So
Okay.
hopefully, after
Okay.
the presentation, we probably have more awareness.
Okay, all right. So for today's session, we're going to be addressing sudden cardiac death and acute myocardial infection ke infarction. How do you pronounce this?
Infarction.
So it's not a typo. Infarction.
Yeah.
Okay, something new I learned today. Okay, let's take a look at sudden cardiac death. Okay, this is very important for everyone to pay attention to.
All right.
Why is it that sudden cardiac death? Okay, let's talk about what it is first. Maybe you can describe.
Sudden cardiac death simply means that a sudden unexpected death caused by mainly change in heart rhythm. So
Oh,
yeah, it's a bit different from heart attack, whereby
yeah.
the blood, due to the sudden clog up of blood vessel that supposed to deliver oxygenated blood, but
Yeah.
the sudden cardiac death are mainly due to the change in heart rhythm. So you're responsible for 50% of all disease death, all heart disease death.
Meaning
So
from slow to it's from slow to fast or fast to slow, or just
any
one
type,
way, which is the more dangerous one?
yeah, both can be dangerous, both can deadly.
Oh, I see.
Means that it had deviate from a normal rhythm that make heart fail to pump. Okay, so sudden cardiac death is not a heart attack like what I said just now, but it can happen during the heart attack. Means that during heart attack and sudden cardiac death is just one of manifestation. Okay,
Yeah. Yeah.
so heart attack occurred when there is a blockages in one or more artery to the heart and preventing heart from receiving enough oxygenated blood. So if the oxygenated blood couldn't deliver to the distal part of muscle, then that part of muscle will become damaged. And
Right.
yeah, the people will have chest pain, will have shortness of breath like that. If the condition continue worsen, that is where the rhythm also affected and sudden cardiac death will follow. So sudden cardiac death occur when the electrical system to the heart is malfunctioned and suddenly become irregular. The heartbeat will dangerously fast and the
Yeah.
ventricle will become fluttering or trembling condition. So they are pumping, but they did not pump very well. So the blood is not delivered to the vital organ like brain.
Yeah.
Just by few seconds, the blood flow to the brain is reduced drastically, and the person will lose the conscious, and that follow.
Okay. For someone to experience SCD, would he or she be would they have to have a history of heart disease or heart problem, or is it like you don't, everything is okay with you? Because I've heard of some people who look like they are very healthy and they're very fit. In fact, some of them may be jogging or working out, and then suddenly they fall, and that would be like the end of it because of a heart problem. So is
Yeah,
it
sure.
something that we can tell
Yeah.
beforehand?
Yeah. Before we come into the risk factor and
Yeah,
who are
okay.
the risk of it, let me show you with the diagram how
Okay.
the subject diagram come. So as you
All right.
can see in this diagram, so the small heart diagram in blue in color, okay. The very left one is a normal how the rhythm goes from the top or sinus node to another and distribute evenly to all part of our heart. But when sudden cardiac death, what happened is the sinus node is firing the signal, but it doesn't cause very well. And because of the damage of the heart muscle, the fiber of the heart muscle, there becomes a lot of loculated firing of signal, and the heart just go haywire. And the muscle that receive the sample, receive the signal, doesn't contract very well and lead to poor function.
Okay.
We can
So
move on.
the thing with SCD is, I mean, in a nutshell, it's actually about the pace of someone's heartbeat.
Yes.
Okay. All right, got it. So how do we treat SCD? Or what's the first thing that the emergency people will try to, if it's not the end already, if it's still not too late?
It is a life and death situation if SCD has happened. So immediate resuscitation is needed. So what we do is whoever come across this group of patient, before come to the hospital, immediate resuscitation is important. So we are talking about CPR, cardiopulmonary resuscitation, and early defibrillation. Means probably you will see in TV shows, some drama, people are using a pad deck to shock the patient.
Yes.
Yeah, this is needed to start. So on the right side, the diagram, you can see a person doing CPR, performing CPR to a collapsed person. On the other side, you can see a device called AED, and you probably will see this sign very often in all the shopping malls or the public area. This is indicate the location of this device, whereby you put on a patient and automatically it can detect the rhythm of the heart, whether need to deliver a shot. And all these procedures actually save life. So again, this brings up the issues. As earlier we perform the resuscitation, the patient survival rate will be higher. So every one of us should encourage to learn how to do a CPR.
Okay, doctor, you were saying that this AED kit, it's available at shopping malls. I mean, in visible areas that people can see in case there's an emergency. But how easy is it to use? Can anyone just, how do you figure out how to use this in an emergency situation where people are panicking somehow, kan?
Yeah, the kits is very well designed for whoever never used before, but nevertheless, it still need a basic instruction, which is included in a CPR program. So, or you can just Google in YouTube. There is a lot of explanation how to use the device, but it's possible to have a basic knowledge on it. And and once you turn the thing on, the machine itself will give some instruction for you to operate it. So, but I will encourage the public to learn CPR and also get the knowledge of this AED.
Okay, so that's CPR. So just quite interested in this AED because I had not noticed that this is actually in public areas. So if we see this and an emergency happens, we just take this, open it up, and then what is there to expect?
It's
on this subject. I might as well just.
Yeah, it's a simple machine that can generate electric impulse for the heart, great enough for the heart to restore the rhythm.
Do you have to? Do you have to have an electrical outlet, or you can?
It's automatically run. You just put on patient, and it automatically run the diagnosis and also deliver the pulse.
Okay.
Yeah. Okay. So it's a very advanced thing, and in a modern country like Malaysia, all the public area are supposed to have. Well, if ones are at risk of heart rhythm and they don't want to give up the activity outdoor. Wherever they go, they should have the information where to allocate this AED. So is the information is always easily available from the concierge.
If you are an existing heart patient, would you advise somebody to get this kit and let's say a portable kit? Oh, no need.
No, it's not cheap, but there is other replacement to do it. So that gadget is called ICD.
Okay, which we're going to be talking about next, right?
Yeah.
Okay,
Yeah.
all right.
This is
what is this?
yes. This is the gadget that I mentioned just now. Instead of carrying a AED, we implant a small minimize AED into patient's heart. This is called implantable cardioverter defibrillator, ICD. So
this is portable.
No, this is implant into patient's
body. Sorry, yes, okay. Clearly states they're implantable. Okay.
If you can look at the diagram over the left hand, there's a heart and there's a device connect with the wire, and the wire is sent down to the attached to your muscle wall. That the computer actually can detect your heart rhythm. When the dangerous rhythm happen, the ICD can detect and can deliver the treatment dose of electrical impulse that restore your rhythm.
How do you control this when it is internal?
You don't control. The computer itself controls it.
You just leave. Oh, I see. Okay.
Basically, it's just a small monitor kit that detects the dangerous rhythm and eventually deliver the treatment pulse, treatment shockable to the shockable rhythm.
Okay. Is this only for people who are at risk of SCD?
Yes. It's not for everyone. It's for certain people that high risk of getting SCD.
In your experience, what's the age of the youngest patient that has needed this gadget?
The youngest person? Well, it depends on the indication actually. There is different indication for putting an ICD. Majority in Malaysia are still used in a heart failure patient.
Okay.
A severely heart failure patient or previously an episode of sudden cardiac arrest before. So it's advisable to put on this device.
Okay, so there you go. That's the ICD. Okay, that now, yes, this is the part that we need to know most. Risk factors of SCD.
Yeah. So please bear with me with the busy slide. So I'm going to talk about the risk factor of sudden cardiac death. So as we know, sudden cardiac death is highly associated with coronary artery disease, means blood vessel disease to the heart or previously heart attack. About 80% of SCD cases are linked with coronary artery disease. And a person who have heart attack with severe heart damage, 75% of sudden cardiac cases are linked to previous heart attack. And this heart attack is higher for the first 6 months after the heart attack. So a person who had heart failure, severe heart failure for whatever reason, in Malaysia mostly due to the coronary artery disease, this group of patients are 6 to 9 months more likely than the general population to experience the dangerous rhythm that can lead to sudden cardiac arrest. Okay. The other risk factor that can cause coronary artery disease, of course, will also be the risk factor for sudden cardiac death. What are they? Number 1, smoking. Number 2, hypertension. Number 3, diabetes. Number 4, obesity. Number 5, family history of heart disease or family history of sudden cardiac death before. And last but not least, a high cholesterol.
Yeah, so these are all interconnected, right?
Yes.
So we always hear of some of like diabetes and obesity, every time we talk about heart or hypertension, it's all mentioned in the same episode.
Exactly, because they are the culprit. They are the source of all evils. So if you can prevent all this, you can prevent coronary artery disease. You can prevent sudden cardiac death. So just
Would you say
simple.
this is Would you say this is like a lifestyle, a result of today's lifestyle?
Exactly.
Like pemakanan, the dietary habits and lack of exercises. Is this something that is related to that?
Definitely, it's associated with modern, so-called modern lifestyle. This type of modern disease actually.
And in Malaysia as well, in your opinion, how bad is our lifestyle now that we may put ourselves at risk of getting all these diseases?
Yeah. Unfortunately, Malaysia are well known to have a bad lifestyle. Okay. So among the Asian, yes, among the Asian country, Malaysia is the most obese country,
Oh,
and the
okay.
prevalence of smoking is very common among Malaysia and including starting from young age.
Yeah.
High pressure
Mm.
is among three out of every three Malaysian will be one hypertension.
Mm.
Yeah.
Is that due
Every
to maybe our kind of food?
definitely we have Malaysia is famous in food. Malaysia is famous all kind of food. Malaysia
Yeah.
is famous in all sort of festival. So
Yeah,
of
that's
course, yeah, I think that
yeah.
contributes to the whole
Yeah
situation.
lah. It's just that I think now people they are more health conscious because there's a lot of awareness about heart diseases, diabetes, and hypertension. But certain habits are very hard to let go of. Like you said just now, when there is a festivity, and then you tend to visit each other. I mean, not now lah because of COVID, but otherwise there's always the makan thing. With the Malaysians. So very tough habit
It's
to
like
break.
I always say, treating disease is not tough at all.
Hmm.
Changing the habit, changing lifestyle is the most tough
Correct.
for the doctors.
Yes, absolutely. Absolutely. Okay, doctor, we're going to look at more risk factors, right, of SCD.
Yeah. Once you have a sudden cardiac arrest, or any of your family have a history of sudden cardiac death, you
Yeah.
are you are at the same risk as well. So, if you do have those experience or your family do have experience, please consult your doctor to check further whether you are at risk of that. And
Okay.
other
Have you ever?
yeah.
Sorry, carry on.
Yeah. Other situation like hypertrophic cardiomyopathy, like means abnormality taken of muscle wall. This is
Yeah.
this is associated with genetic issue, and
Yeah.
other congenital abnormality like means that you born with abnormal heart structure or abnormal blood vessel structure. Those are
Yeah.
those are high risk of sudden cardiac
Iris.
death.
Yeah.
Other
Okay.
than that, is um, recreation drug abuse, substance abuse, or you take other medication that actually is the pro-arrhythmic, means that promote abnormal rhythm. This
Yeah.
is not common among those unlicensed slimming pill.
Yeah.
Yeah.
There's another list of risk factors also, then, doctor. I think after this,
So that's
the next slide.
sudden cardiac. Okay.
Okay. All right. Doctor, I was
So
going to ask you just now about age. Is that a risk factor as well?
age.
Yeah.
For sudden cardiac death per se, there's not really an age, but as we know, sudden cardiac death is associated with coronary artery disease, and age is one of the risk factors for coronary artery disease. So it's like a sequence. You get older, you have high risk of heart attack, high risk of
Okay.
coronary artery disease, and
Yeah.
followed by high risk of sudden cardiac death.
Okay. And between men and women, which would you say is at a higher risk?
Sudden cardiac death is more common among men, but due to coronary artery disease are more common among men.
But you have come across before young patients who have had SCD, and perhaps young women with SCDs as well.
Yeah, young patients who had SCD basically because of their genetic predisposing them to some disease like Hockham, like the abnormal thickening of the cardiac wall, and the genetic that predispose them to abnormal rhythm of the heart.
Yeah.
Yeah, all these are more common among the younger age.
Right.
So they are often undiagnosed, means that they do not know that, and often you see the younger age pass away due to this problem actually.
Yeah, Doctor, there also there have been instances where we see sportsmen, for example, soccer players, they're on the field and then suddenly they collapse, and then they pass away. We've seen this quite a few. There are famous soccer players who have had these SCD before. So some people think that it's because they push themselves beyond their maximum heart rate, and this is why the heart problem happens. Is that true?
Not really, not really. So I can see the search result that I got just now. Just you show that a few professional sport player collapse suddenly. This is because they are professional athletes, so their training is tremendously a lot compared to a normal one.
Yes,
so that make them have athletic heart. We call it athletic heart. The heart are more bulky. They pump the oxygenated blood more efficient to the whole body. And because of the heart is bulky, actually it disturbs the heart pumping up from the blood. So we call it athletic heart. It's one of the Hockham. It's one of the thickening of heart muscle wall.
Yeah.
To the heavy load of training.
Okay.
Yeah, but once but once they stop.
Carry on.
Yeah, but once they stop exercise, the heart might shrink. This is a bit different from the genetic predisposed. This is more to a training, more to a workload predisposed.
Yeah. Sorry, you were saying once they stop exercise?
Yeah, the treatment for them is stop exercise for this group of poor athletes. But the challenge is how to diagnose them.
Yeah.
So most of them, they are underdiagnosed.
Okay, for the rest of us who are not sports people generally, so let's say we're doing something like some cardio workout, and then most of it we have smartwatches that could possibly tell our maximum heart rate, and when it is beyond that, so some of us like a bit scared they're quite anxious in case anything happens to the heart. Is that something real to be afraid of, or it doesn't happen that way unless you are in the high risk group?
When you do exercise, your heart rate is expected to be increased.
That is, but you shouldn't push yourself beyond the boundaries of maximum heart rate. That's like the assumption.
I do not encourage people to go maximum. I mean, go too extreme on the exercise in one go. You can set your goal for your exercise to a very high limit, but you must schedule them. You must have a program on them, and you must get professional advice on them. Just like our target heart rate, there is a formula to calculate our target heart rate. Okay, so if one immediately go to the extreme exercise, it's a great stress for our heart.
Yeah.
Especially, a lot of us do not know how good is our heart function, and straight away you go to the extreme.
Yeah.
Next, you most of the time you will bring casualty actually.
Can happen. Yeah. That's true. I've had a friend who had never been active in sports and not even jog or anything. And then one day he just got up and he suddenly felt that okay, today is the day that he's going to start exercising. So he starts running a few rounds around the park, and then he collapsed, and that was the end of it. And we were
That
of
is
course shocked because that there didn't seem like there was any problem.
unfortunate. Sorry about
Yeah,
that.
sorry. I mean, it's a long time ago. I just wanted to relate that.
So
Okay.
that
Sorry.
bring me to another point,
Yep.
that I need to highlight to the public is,
Mm.
you must know your condition. You must know how's your health. But
Yeah.
by doing that, you
Mm.
need to do something to get the information about yourself.
Yeah.
So
Right.
screening program is very important. A screening program will help you to understand yourself more.
Yeah.
And regular exercise will tell you every day how good is your body. If you
Yeah.
never do exercise, you will never know how good your body is. But if you do regular exercise, you can compare. Maybe 1 month ago, I can jog 5 rounds, but today I only can jog 1 round. That's definitely something is wrong. So that
Mm.
is when you should get medical attention.
Okay. Okay. So these are some of the signs in order for us to just pay a little bit more attention. Okay. All right. So that's good to know. Okay. Now we're going to talk about heart attack because obviously SCD and heart attack is different, as you mentioned just now. So, okay, what exactly is a heart attack? How would
So
you
heart attack is a bit different from sudden cardiac death. I mean, they are totally different thing, but sudden cardiac death often occurred during heart attack. Okay, like what I told you just now, sudden cardiac death is because of the rhythm problem. It's more like
yeah,
the electrical impulse problem.
yeah,
So the and very often, more than 50% of sudden cardiac death will occur during heart attack. Heart attack is simply because of the blood vessel in our heart is clotted
yeah,
up. Yeah,
yeah,
and then causing damage to the muscle wall of the heart
mm,
and
mm,
lead to problem of deliver the electrical impulse and cause
yeah,
sudden cardiac later. So it's interrelatable.
okay,
The symptoms will be a bit different. Usually, if a sudden cardiac death, people tend to have some giddiness and fainted late after that. Whereas heart attack, usually there is the most common complaint is a chest pain. If you see the slide I showed previously, is a gentleman who holding the chest. That is a cardinal sign. That is a universal sign of chest pain. If you see someone holding the chest, looks difficulty, sweating away, please go in front and offer your help. Most likely he's having a severe chest pain and there's ongoing heart attack and sudden cardiac arrest might happen if we just ignore it like that. Your mic is mute.
sorry, okay, sorry. So, what was I? Heart attack can cause sudden cardiac arrest. Is that right?
Yes.
Okay, but not vice versa.
Usually no. It's a
Okay.
sudden
So
cardiac arrest.
sudden cardiac arrest,
Yeah.
it is a symptom.
Of heart attack. It's part of heart attack.
Okay, it's part. Okay, I see. All right. So basically, heart attack is the bigger picture lah. Like when
Yeah.
you you mentioned it, a plumbing problem. So when you have any blockages, this will cause SCD, correct?
Yeah. But of course, certain cause of STD are not related to plumbing problem, like genetic issue.
Yeah.
People born with that, or
Right.
active heart
Mm.
doesn't really have blockages of the blood vessel, but they still
Yeah.
can have something like that. But in most cases, sudden cardiac arrest occurred
Yeah.
together with a heart attack.
Okay. Okay, doctor, another question. Is sudden cardiac arrest the same as sudden cardiac what do you call it just now? Disease, was it? Sudden cardiac disease.
Okay,
SCD. Oh no,
sudden
sudden
cardiac,
cardiac death.
yeah, sudden cardiac arrest. Arrest mean uh, heart stopping.
Yeah, yeah.
Is a condition. Sudden cardiac death, of course, the person already died.
Okay. All right. So these are two separate things
Yes,
lah. Okay.
sudden cardiac arrest
Mm.
is in the progress of getting it. So with the appropriate rescue,
Mm.
patient can revive from there.
Okay. All right. We've got quite a few questions actually, doctor. So that's good. Means, people are getting interested in the topic and they do have certain things on their mind to ask. But before we get to that, is there anything that we can do to lower our risk of getting heart attacks? Is there anything within our control that we can change?
Yeah, I would suggest everyone understand their risk factor. There are a few
Yeah.
risk factors that are correlated to coronary artery disease,
Yeah.
like obesity, diabetes, high blood pressure, cholesterol problem, smoking habit, a sedentary lifestyle that no exercise and all that. You, all these are modifiable risk factors,
Right.
and if you do not do anything to change it or improve it,
Yeah.
it will lead us to coronary artery disease, which highly associated with sudden cardiac death. Okay, of course, there are some other risk factor together with the disease, like family history. So knowing if you, it's important to know your family. Anyone had previously sudden cardiac death or sudden cardiac arrest or very severe coronary artery disease. If you do have that, you should get yourself body checked and understand how is your body condition. The other non-modifiable factor like age is something we cannot do. Gender is something we cannot do. But
Yes.
gender-wise, male is more common than female.
Yeah.
Age,
Yes.
elderly more than 45 years old for gentlemen, and lady who are menopause, post-menopause 2 to 3 years, they are higher risk of getting a coronary artery disease, which
Yeah.
highly associated with sudden cardiac death.
Yeah. Yeah. I think women generally, when they think about diseases that kill, it's always about breast cancer and perhaps diabetes. But heart attacks, I think not many of us are aware that it can actually become a problem. So
Yeah.
when you suggested health screenings, is that something that you suggest to women as well on an annual basis?
Yes, I will suggest women with strong family history,
Yeah.
yeah, and women postmenopausal 2 to 3 years,
Mm.
welcome to do health screening
Okay.
annually. Yeah. So I will also take the opportunity to educate the public to
Mm.
participate, to learn basic life support.
Yeah.
Imagine if
For
we are
example.
healthy, apart from being a patient, we also can be a rescuer.
Yeah.
So knowing majority of the death are preventable
Mm.
or can be salvaged if the help delivered early. But unfortunately, the awareness are still very low. Not
Mm.
many of us are qualified as a basic life support.
Okay.
Just bear in mind, this is not just um, a paramedics, doctor's job, nurse's job. No, this is everyone. You see anyone collapse on the uh, ground on the public area,
Yeah.
anyone can be the helper, can be the rescuer if
Mm.
you possess with the knowledge of basic life support. So
Mm.
also just simply Google the courses that are available in online. It's
Yeah.
easily available. The
Yeah.
institute that constantly provide this type of education
Yeah.
Malaysia Heart Society and also
Yes.
IJN. Yeah, and of course, there's a few volunteer group as well. They do regular teaching to the public with
Okay.
a very
So basic
affordable.
life support. It's a CPR, right?
Yes.
Okay. Is there anything else? Let's say if we don't know about CPR, is there anything else that we can do to someone whom we have witnessed suddenly collapsing? If it's
It,
if it maybe massaging the chest, I don't know. I'm just guessing. Other than CPR.
it will be a bit difficult to lend your hand for help if you do not have basic knowledge. So
Okay.
just get help as soon as possible. Do not do anything. Just get help as soon as possible.
Okay, all right. There you go, ladies and gentlemen. That's another reminder, why we must take up CPR lessons, because we might be able to save a life, inshallah. Okay, doctor, let's take a look at our questions because we've got quite a few. Oh yeah, you would like to give some tips and advice.
Yeah, if you
Yeah.
join late, the talk late, and if or you doze off in between, or you are feeling bored in between,
Yeah.
just forget about whatever I say. Just concentrate on this a few messages that I want to
Okay.
let everyone know. So number one, you must understand your health condition. By doing that, get yourself a health screening to understand your health condition.
Yeah.
Number two is understand your risk factor.
Mm.
Health professional probably after seeing you probably will able to advise you what are your risk factor right now and how high is your risk of getting a heart disease. Number three, if you are a patient who had diabetes, hypertension, or cholesterol problem, or even a existing heart disease patient, seek medical attention earlier and compliance to the prompt treatment.
Okay.
It's very important.
We've got one more, right? Okay.
Lastly, everyone, apart from being the victim, you can
Yeah.
be the rescuer. So basic life support is not for paramedic, it's for everyone. So
Mm.
get your friends, get your colleague, set a goal for this 2021. Become a basic life support provider.
Yeah. Let's hope there'll be more training, workshops on CPRs. I think that'll be
Yes,
very
exactly.
helpful as well.
Imagine everyone know basic life support, like how you
Yeah.
know your driving skill.
Yeah.
The help will deliver immediately.
Yeah. Yeah. Of course. And it's not just for heart attack, it's going to be for other things as well, right?
Exactly.
So very essential. Okay, that's something good to note. Okay, let's take a look at the questions that we have. First one is from Miss Chan Lee Hong. Hi doctor, do you recommend yearly CT angiogram, calcium scoring for those who have strong family history and poor diet control? Okay, what's your thought on that, doctor?
I would not go straight with more invasive screening program like CT scan for as an annual checking. There's many way to do it. So one of the way is stress test, stress echo. All these are really not invasive compared to a CT scan. Of course,
Right.
no one treatment fit every patient. So if the person only can do a CT scan, then maybe a scheduled CT scan is also benefit too.
Okay, I hope that answers your question, Ms. Chan. Let's take a look at the next one from Ms. Elena Tan. What is the maximum heart rate that we should be looking out for?
It depends on what activity you do. So as average, our heart rate is around 80 to 90, 80 to 100. So it depends on what are you doing. So heart rate is not something that concern every time. So if you are doing exercise, it depends on how intensive is your exercise.
Yeah.
If you are at rest, your heart rate probably will lower. If you are in stress condition, or you just done some activity, or even you are quarrel with your husband, your heart rate probably will go up.
Okay. Okay. Next is by Ms. Gwen Yap. I can feel my chest pain occasionally sometimes shortness of breath. These always happen for a few short minutes, and they are just occasionally, not frequent. My ECG and health reports are perfectly fine. Should heart disease be something I should be concerned about?
Most of the time, this we have to look back on the risk factor,
Mm,
the age group. If a healthy lady without any significant family history, and
yeah.
they are still in the productive age, means that they are still having menses,
Yes.
um, and they do not take any special medicine like contraceptive pill, and heart disease is less likely happen on
Mm,
them. So if the ECG and checking looks normal, then
mm.
the complaint probably not from the heart.
That's good to know. And then Mr. Muhammad Faisal Yusof, just to know, is it true? I heard that it's not we don't advise exercising at night. It seems like it's common for having sports at night, like futsal or badminton. Yeah, this is very true. People don't have time in the daytime. Okay, so there's few cases, sudden deaths during sports at night. What's your thought on that, doctor? This is very true.
Um, Exercise at night usually associated with increase of blood pressure at night, which is supposed to be
Yeah,
low. It more often is the diastolic blood pressure, which is the lower number of this one. Well,
yeah,
is uh, timing that your heart not supposed to be in stress, but is in stress. So overall, after some time, it will become a great stress to your heart. But it does not really directly lead to heart attack. Most of the cases that we heard is a person that do not do exercise or do not know their condition, and then after the exercise, like what I say, it's a great stress to your heart, and the heart
yeah.
just the disease just pop up.
Yeah, yeah. So it's not regarding timing lah, whether exercise in the daytime or nighttime. That's not one of the risk factors lah.
Well, if we follow back the or the usual resting and exercise time of a human being,
Mm. Yeah.
night exercise is not really a suitable time.
Oh, okay. All right. So that's something to note as well. Okay, Miss Gwen.
Your mic, Shakina, your mic.
Oh goodness, I'm so sorry. Okay, Miss Gwen Yap's asking, will frequent Tabata or HIIT exercises stress our heart?
Tabata and HIIT intensive exercise.
Yeah.
The idea is a cardio exercise to be. So how to qualify as a cardio exercise is you must reach a target heart rate. So it is to stress your heart to achieve a dedicated heart rate in order to burn fat. So if you had existing heart problem, get a professional advice regarding how strong is your heart. And a person that never do exercise before, also get a professional advice how much you
Yeah.
can go.
Yeah.
So the easy way to do it is you do not do everything in one go.
Yeah.
So you must schedule yourself, stagger your exercise plan, and eventually achieve the target that you want.
Yeah. Because this is really high intensity exercises actually. Tabata
Yes.
and HIIT exercises.
Yes.
How about you, doctor? Do you work out?
Yeah. Not too much of Tabata, but this one
Okay.
lifting. Yeah.
That's good. That's good. Yeah, we all should have some form of exercise. Okay, one last question by Mr. Jeffrey Ngong. If one was on a treadmill test and experienced a drastic drop in heart rate and passed out, oh my goodness, passed out for a few minutes after completed the treadmill test, is that a sign of heart disease?
Yes, it is.
Mm,
It's a significant positive stress test.
okay. So you need to go to a doctor immediately and check the actual state of your heart health.
Yes.
Okay, all right. Thank you so much, doctor. It was a wonderful session, and your information is very useful. I hope you all, ladies and gentlemen, will take a note of doctor's advice. That was Dr. Min Yeong from Columbia Asia Hospital, Setapak, who is the consultant cardiologist. Yeah. Thank you again, Dr. Thanks for being with us. Okay, bye everyone. See you soon.